Let me start with a scene many of you will recognize. A healthy 44-year-old, let's call her Sarah, orders a taco salad from a fast food counter on her lunch break. Nothing unusual. She's eaten 100 salads just like it. 4 days later, she's doubled over in the bathroom for the 6th time that day, so exhausted she can barely stand, wondering if she's dying of food poisoning, a stomach bug, or something worse. She goes to urgent care. They run a standard stool test. It comes back negative. She's told to rest and drink fluids. 3 more weeks go by. She's lost 12 pounds. She still can't hold down a full meal. Finally, a persistent physician orders one more specific test, and the answer appears: Cyclospora. I tell you Sarah's story, and it is a composite of thousands of real patients this year, because right now, in the summer of 2026, this exact scenario is playing out across dozens of American states. As of this month, more than 1,000 laboratory-confirmed cases of this parasite have been reported to the CDC, with thousands more probable cases under investigation, numbers dramatically higher than this same point last year. Hundreds of people have been hospitalized. My name isn't important tonight. What matters is that I'm a physician, and I want to talk to you honestly, not to frighten you, but to arm you with the kind of clear, evidence-based understanding that turns a mysterious, scary illness into something you can recognize, respond to, and largely prevent. Why does this topic matter in real life? Because most people have never heard the word Cyclospora until they're sitting in a clinic, sick for weeks, wondering why nobody can tell them what's wrong. Tonight, I want to change that. By the time I'm done, you'll understand what this parasite is, how it gets into our food supply, why it's so hard to catch, literally and diagnostically, and, most importantly, what you can do to protect yourself and the people you love. 2. Introduction to the topic. So, what exactly are we talking about? Cyclosporiasis is an intestinal illness caused by a microscopic single-celled parasite called Cyclospora cayetanensis. I know that's a mouthful, so let's break it down. Cyclo refers to its rounded shape. Spora refers to the fact that, like many parasites, it survives outside the body as a hardy, dormant form called an oocyst. Think of it as a tiny armored seed that can survive in soil and water for a surprisingly long time, waiting for the right conditions to hatch and become infectious. This is not a virus, and it's not a typical bacteria like Salmonella or E. coli, which many of you have heard of from other food recalls. It's a parasite, a living organism that needs to get inside your digestive tract to complete its life cycle at your body's expense. People become infected by consuming food or water contaminated with this parasite, almost always traced back to produce that's eaten raw. Lettuce, herbs like cilantro and basil, snap peas, and various berries have all been implicated in past outbreaks. Here's a detail that surprises most people. This illness does not spread from person to person the way a cold or stomach flu does. You cannot catch it by sitting next to someone who's sick or from casual contact. The oocyst needs time in the environment, typically days to weeks, before it becomes capable of infecting someone else. That single fact should already ease some anxiety. This isn't going to sweep through your household the way norovirus might. Why should you care about this specifically right now? Because 2026 has seen an unusual surge. Case counts typically rise every summer. The CDC even designates May through August as Cyclosporiasis season. But this year the numbers are substantially higher than in recent years. One cluster of illness, linked to shredded iceberg lettuce served at a well-known fast food chain, has affected people across 5 states. Health investigators traced it back to a single farm's lettuce supply. That lettuce has since been recalled. But, and this is important, investigators believe there are multiple separate outbreaks happening simultaneously this year, not just one single nationwide event, and several of them still have no identified source. 3. Medical explanation. The science behind it. Let's go a little deeper into the biology because understanding how this parasite operates will help you understand everything else I'm going to tell you. Imagine your small intestine as a soft, absorbent carpet, lined with millions of finger-like projections called villi, whose job is to soak up nutrients from your food like tiny sponges. When you swallow food or water containing Cyclospora oocysts, those oocysts survive your stomach acid, which is itself remarkable, since stomach acid destroys most invaders and travel down into your small intestine. There, they release their infectious form, which burrows into the cells lining that carpet and begins to multiply. As the parasite multiplies inside your intestinal cells, it damages the villi, flattening and disrupting those absorptive fingers. The result is an intestine that can no longer properly absorb water, salt, and nutrients from what you eat and drink. That's the direct mechanical cause of the hallmark symptom of this illness: watery, sometimes explosive diarrhea. Your gut isn't being invaded by something that's simply irritating it. It's being structurally altered so that it stops doing its job of absorption, and instead, everything passes through. New oocysts are then shed in the stool. But here is the critical piece of biology that makes this parasite so uniquely difficult to control. Freshly shed oocysts are not yet infectious. They need to spend anywhere from roughly 1 to 2 weeks in the outside environment, in warm, moist conditions, to mature or sporulate into a form capable of infecting another person. This is fundamentally different from something like norovirus, where the moment it leaves your body, it's ready to infect the next person within hours. This maturation requirement explains several things people find confusing. Why the illness clusters in warm months when environmental conditions favor that maturation process. Why it isn't spread directly from person to person, even within families. Why contamination tends to be linked to water sources: irrigation water, wash water, or water used in the fields, rather than direct contamination during food preparation, the way you might imagine a sick food handler contaminating a salad bar. So, who is at risk and how does contamination actually happen? The leading theory across decades of outbreak investigations is that contaminated water, whether used to irrigate crops, mix pesticides, or wash produce after harvest, introduces mature oocysts onto the surface of fruits and vegetables that are typically eaten raw and unpeeled. Once that oocyst is sitting on a lettuce leaf or a sprig of cilantro, ordinary washing at home does very little to remove it, because the oocyst's tough outer shell is specifically built to resist environmental stress. I want to say something honestly here, because it's medically relevant and I won't sugarcoat it. Agricultural sanitation infrastructure genuinely matters to this story. Reliable access to clean water for irrigation and washing, functioning field sanitation facilities, and hand-washing access for agricultural workers are all part of the chain that keeps produce safe before it ever reaches a truck, a warehouse, or your plate. This isn't a story about any particular group of people. It's a story about water quality and sanitation infrastructure throughout a very long and complex supply chain, often crossing international borders before a vegetable ever reaches your fork. Improving food safety means investing in that infrastructure at every step: farm, processing facility, and transport, not assigning blame to any single group of workers. An analogy that helps patients understand this: think of the produce supply chain like a very long relay race with dozens of runners: farms, water systems, harvesting crews, washing and processing plants, distributors, restaurants. A single contaminated baton, one water source, one piece of equipment, passed at any point in that race can end up contaminating enormous volumes of produce distributed across many states, which is exactly why traceback investigations are so difficult and can take investigators weeks to complete if they succeed at all. 4. Symptoms and warning signs. Let's talk about what this illness actually feels like, because recognizing it early can spare you weeks of unnecessary suffering. Symptoms typically begin about 1 week after exposure. though the range can stretch from 2 to 14 days. That delay is itself part of the diagnostic challenge. By the time you're sick, you may have eaten dozens of meals since the exposure, making it very hard for you, or even a trained investigator, to pinpoint which meal was responsible. The hallmark symptom is watery diarrhea, often frequent, sometimes explosive, and it can persist far longer than a typical stomach bug. While an ordinary viral gastroenteritis often resolves in a day or two, untreated cyclosporiasis frequently drags on for weeks and, in some documented cases, months, with symptoms that wax and wane. Other common symptoms include loss of appetite, significant weight loss, some patients lose 10 pounds or more, profound fatigue, abdominal cramping and bloating, nausea, low-grade fever, excessive gas. One pattern I want you to notice because it's a genuine warning sign: relapsing symptoms. Patients often describe feeling somewhat better for a few days, only to have the diarrhea and fatigue return in waves. This cyclical, relapsing pattern is a recognizable fingerprint of this particular parasite, and it's one of the clues that should prompt you and your doctor to consider testing for it specifically, rather than assuming it's an ordinary and self-limited stomach virus. When should you seek medical attention? I'd encourage you to see a doctor if diarrhea lasts more than 2-3 days without improvement. You notice signs of dehydration, dark urine, dizziness when standing, a dry mouth, reduced urination. You're losing significant weight without trying symptoms. Relapse after seeming to improve. You have a weakened immune system for any reason, since illness can be more severe and prolonged in that setting. You develop a high fever, blood in your stool, or severe abdominal pain. These can point to something more urgent and should never be ignored. I want to be careful here, not to alarm anyone unnecessarily. Most people with ordinary diarrhea have a self-limited viral illness that resolves on its own within a couple of days. The point of this list isn't to make you fear every stomach ache. It's to help you recognize the specific pattern that should prompt you to ask your doctor directly, could this be Cyclospora? 5. Diagnosis and medical evaluation. Here is one of the most important and most frustrating things I can tell you about this illness. It is not detected by a standard stool test. Most clinics, when you come in with diarrhea, will run what's called an ova and parasite panel, or a multiplex gastrointestinal PCR panel. Depending on the specific panel used, Cyclospora may not be included in the standard testing menu at all. This means a patient can be tested, told their results are normal, and sent home, while still harboring the parasite. This is precisely why public health agencies have had to specifically remind physicians this year, if a patient's history and symptoms suggest cyclosporiasis, doctors need to explicitly request cyclospora testing, rather than assuming a general stool panel will catch it. If your doctor does test specifically for it, that testing usually involves a stool sample examined under a microscope by a trained laboratory technician looking for the parasite's distinctive oocysts, sometimes using special staining techniques to make them visible. PCR testing, a molecular technique that detects the parasite's genetic material, which tends to be more sensitive than the microscope alone. Because the parasite is shed intermittently, meaning it's not present in every single stool sample, even in someone who's infected. Sometimes more than one stool sample, collected on different days, is needed to make a reliable diagnosis. I share this so that if your first test comes back negative, but your symptoms persist and match this pattern, you understand why your doctor might reasonably ask you to test again, rather than assuming the negative result rules the parasite out entirely. What does this mean practically? If you have prolonged, unexplained diarrhea, especially during the warmer months, the most useful thing you can do is be direct with your physician. Tell them how long you've been sick, describe the relapsing pattern if you have it, and specifically ask whether Cyclospora testing has been included or whether it needs to be ordered separately. You are allowed to be your own advocate in that exam room. In my experience, That one question, have you specifically tested for Cyclospora, has shortened many patients' diagnostic odyssey from months to days. 6. Treatment and management. The good news I want to deliver clearly. This illness is treatable, and most people recover fully. The standard evidence-based treatment is a combination antibiotic called trimethoprim sulfamethoxazole. You may know it by a brand name like Bactrim or Septra. This medication is highly effective against Cyclospora and typically leads to significant improvement within days of starting treatment. For patients who have a genuine allergy to sulfa medications, this becomes more complicated, since there are currently no well-established, equally effective alternative antibiotics for this specific parasite. This is exactly the kind of situation where your treatment plan needs to be personalized with your physician, weighing the severity of your illness, your allergy history, and other treatment options that may be available on a case-by-case basis. Beyond the antibiotic itself, supportive care matters enormously, and this is where you play an active role in your own recovery. Hydration is the single most important thing you can do at home, because the illness causes your intestine to lose its ability to absorb water and salts, replacing fluids, ideally with an oral rehydration solution containing electrolytes, not just plain water, helps prevent the dizziness, fatigue, and complications that come from dehydration. Rest. Your body is fighting a genuine infection and repairing damaged intestinal tissue. Fatigue during this time is expected and not something to push through by force. Gentle, bland nutrition as your appetite returns. Foods that are easy to digest can help your gut recover without overtaxing it. Follow-up testing, in some cases, to confirm the parasite has cleared, particularly if symptoms don't fully resolve after treatment. I want to underscore something important. If you suspect you have this illness, please do not attempt to self-diagnose or self-treat with leftover antibiotics from a previous illness. Trimethoprim sulfamethoxazole needs to be prescribed at the correct dose and duration for this specific infection, and taking the wrong antibiotic or an incomplete course will not clear the parasite and can contribute to broader problems with antibiotic resistance. This is a conversation to have with your physician, not a do-it-yourself project. 7. Prevention and healthy habits. Now for the part I care about most, because prevention is where you truly have power. Here is a piece of honesty that surprises most people. Ordinary washing of produce at home does not reliably remove this parasite. The oocyst's protective shell is specifically built to resist environmental stress, including plain water rinsing and even some chemical sanitizers. That doesn't mean washing produce is pointless. It still removes dirt, reduces other contaminants, and is good general practice. But I don't want anyone walking away tonight believing that a quick rinse under the tap guarantees safety from this particular organism. So what can you realistically do? During an active outbreak, stay informed. Health departments and the CDC publish specific advisories naming the exact product and, where known, the source. For example, this year's advisory specifically named shredded iceberg lettuce from a particular supplier, served at a particular restaurant chain in 5 named states. Paying attention to those specific advisories, rather than assuming all lettuce or all produce is dangerous, will help you make informed choices without needlessly avoiding entire food groups that are, in fact, safe and nutritious. Cooking kills this parasite. Thoroughly cooked vegetables do not carry this risk the way raw produce can. If you're in a region with an active outbreak and feeling uneasy, choosing cooked vegetables over raw salads for a period of time is a reasonable, practical step. Know your supply chain when you can. Buying produce from sources with strong, transparent food safety practices and supporting continued public investment in agricultural water quality testing, sanitation infrastructure, and FDA/CDC surveillance systems genuinely reduces the odds of contamination reaching your table in the first place. This is a system-level protection, not just a personal one. and it's worth caring about as a citizen, not just as an eater. If you're immunocompromised, taking extra precautions with raw produce during outbreak season. Favoring cooked vegetables, staying attentive to advisories, is a sensible, individualized conversation to have with your doctor. Report your illness. If you're diagnosed with Cyclosporiasis, cooperating with your local health department's interview process, even though it can feel tedious to recall everything you ate over the prior 2 weeks, is genuinely how outbreaks get solved and future illnesses get prevented. Public health surveillance depends on people like you. I also want to gently note something for those of you who care about food policy. Several public health organizations have pointed out that budget reductions to national foodborne illness surveillance systems have made it harder to trace some of this year's outbreaks to their source. Several 2026 clusters remain unsolved for that reason, as have several clusters in past years. Whatever your politics, robust public health surveillance capacity is directly, practically connected to how quickly contaminated products get identified and pulled off shelves, which is, quite simply, how illnesses like Sarah's get prevented for the next person. 8. Common myths and misconceptions. Let's clear up a few misunderstandings I hear constantly in clinic. Myth: if I have diarrhea, a regular stool test will catch whatever's causing it. Reality: as I explained earlier, standard panels frequently don't include Cyclospora testing by default. A normal stool test does not rule this parasite out if your doctor didn't specifically request it. Myth: this spreads like a stomach flu, person to person. Reality: it doesn't. The oocyst needs days to weeks in the environment to become infectious. You cannot catch this from a sick family member the way you'd catch norovirus. Myth: washing my vegetables well protects me completely. Reality: washing is good general hygiene and removes many things, but it does not reliably eliminate this specific hardy parasite. Cooking is far more protective than washing alone. Myth: this only happens because of imported produce or because of one specific group of people. Reality: contamination has been linked, across many years and many outbreaks, to a wide range of domestic and imported produce and a wide range of water sources throughout long, complex supply chains. It's a systems and infrastructure issue: irrigation water quality, field sanitation, processing hygiene, not something attributable to any single nationality, immigration status, or group of workers. Blaming a group of people rather than examining the water and sanitation systems involved doesn't just misdirect anger. It actually distracts from the real, fixable infrastructure problems that would prevent the next outbreak. Myth: if antibiotics don't work right away, nothing will help. Reality: most patients see significant improvement within days of starting the correct antibiotic. Full recovery, including the gut's return to normal absorption, can take a bit longer, but the outlook is genuinely good for the overwhelming majority of patients. Myth: this is a rare, exotic illness that will never affect me. Reality: while individual risk in any given year is still low, tens of thousands of confirmed and probable cases have occurred in the U.S. this year alone, and case numbers have been rising over the past decade. It's uncommon, but it's not exotic, and it's worth knowing about. 9. Doctor's advice. If you take one thing from tonight beyond the facts, let it be this: I've cared for patients who spent weeks, sometimes months, feeling dismissed, told their tests were normal, told it was probably just stress or a lingering virus, while quietly losing weight and energy to an infection that, once correctly identified, cleared up within days of proper treatment. The gap between suffering and recovery, in this illness more than almost any other I treat, is knowledge. Knowing the right question to ask, knowing the right test to request, knowing when persistent symptoms deserve a second look rather than quiet endurance. I don't want you to leave here anxious about your next salad. I want you to leave here informed, Someone who knows that persistent, relapsing diarrhea deserves a direct conversation with your doctor about Cyclospora testing. Someone who knows that hydration and appropriate antibiotics, not vague reassurance, are the path to recovery. And someone who understands that food safety is a shared infrastructure project built from farm to fork that benefits from public investment and everyone's attention, not panic. Taking responsibility for your health here doesn't mean living in fear of fresh produce. Produce remains an essential, healthy part of your diet, and I'd never want anyone to abandon fruits and vegetables out of fear of a parasite that, in any given meal, remains a low-probability event. It means paying attention to public health advisories during outbreak periods, recognizing the specific symptom pattern I've described, and advocating clearly for yourself in a doctor's office when something doesn't resolve the way an ordinary stomach bug should. Let me leave you with this image. Somewhere on a farm, hundreds or thousands of miles from your kitchen table, a drop of water carries something invisible to the eye onto a leaf of lettuce. That leaf travels through processing plants, distribution centers, trucks, and finally onto a plate in front of someone like Sarah, someone doing nothing wrong, simply eating lunch. The distance between that farm and that plate is where food safety either succeeds or fails, and it depends on clean water, functioning sanitation, careful processing, and vigilant public health surveillance at every single step along the way. You now know more about Cyclospora than the overwhelming majority of people walking into an emergency room with unexplained diarrhea this summer. You know it's a parasite, not a virus or ordinary bacteria. You know it doesn't spread person to person. You know it requires specific testing that isn't automatically included in a standard panel. You know it's treatable, and that most people recover fully. And you know that real prevention lives not in fear of your grocery store, but in informed attention to advisories, to your own body's signals, and to the public health systems that quietly protect all of us, often without our ever noticing, until the summer they're stretched thin. My hope for you isn't that you'll never get sick. My hope is that if you do, you'll recognize the pattern early, ask the right question, get the right test, and get better fast, because you were informed, not afraid. Thank you.